Hi, my name's Dave Welch, and I'm a registered nurse in Chico, California. I work in cardiac rehabilitation at our local hospital up there. I've been there for I've been a registered nurse for 26 years, been doing cardiac rehab for most of that time, and I spend my life teaching people about healthy behavior, keeping their cholesterol down and eating healthy and exercising and all those things, and try to do most of those things myself. And I've never really thought of the possibility that I would end up being a person who would have a problem with health insurance because of my good health, because I've been so conscious of it, because I work in a profession where I'm lucky enough to have pretty good insurance coverage. But last summer I decided that I had reached a point in my life where I was ready to go to per diem at work, meaning irregular hours and giving up my health benefits. And I thought that I would be a good candidate, having studied the situation pretty well, that I would be a good candidate for one of the high deductible insurance policies combined with a health savings account.
Insurance providence got to go! Insurance providence got to go!
For most people, a program like that's a disaster. But for someone like me who is quite healthy, relatively well off financially, and pretty medically sophisticated and able to be a sophisticated consumer, I'm actually one of the few people that it probably works fairly well for. And so I thought that that would meet my health insurance needs until I reached Medicare age.
In 2006, insurance that cost $100, for example, in 2000, now costs $187. That's an 87% increase from 2000 to 2006. That's remarkable.
But I also figured that I had a few things to do, and before I went onto that high deductible policy and started paying for all the little things myself, I would get a few things taken care of. Go to the dentist, go to the eye doctor, get some new contact lenses, things like that, get all that sort of stuff taken care of. And the last one on the list was go to the dermatologist. And my dermatologist, looking me over pretty carefully, discovers this tiny little skin cancer on the side of my nose, which really wasn't even significant enough that I had noticed anything there. Because of this little skin cancer, I am uninsurable according to Blue Cross of California and according to the other insurers who sell health insurance in my area. And this is, in some ways, I'm almost embarrassed to tell this story because compared to the kinds of disasters that many people find themselves in with health insurance, the kind of catastrophic situations with people being bankrupted by failures of their insurance, or people with awful catastrophic diseases, my problem is pretty minor by comparison. And yet, if someone like me, with what I know and with the good fortune that I have, if someone like me can end up uninsured and uninsurable, it really shows you that anyone can.
Currently, the United States spends about 30 to 60% more on our drugs than any other industrialized country. And it's because we allow the pharmaceutical corporations and the health insurance industry to dominate our healthcare policy instead of what really makes sense for our patients.
To realize that I probably live in the only industrialized country in the world where someone has to shape their life choices around making sure that they have health care. That's a ridiculous place to have to be.
We need to get the healthcare dog under control. That's not happening. We have an opportunity to do that right now. California's a CULE bill, so it's a good single-payer bill. Nationally, Conyers Kucinich with HR 676. We're long past time for something like that to happen.
One of the things that I've really wanted to be able to do more of one of the reasons I wanted to cut back on work is because I really enjoy long distance cycling. That's one of my great enthusiasms in life, and my wife and I take an annual tandem bike tour of 3 weeks or so, and so that's really, that's one of the things that I have really looked forward to being able to do more of. And of course, the other thing that I've really looked forward to being able to do more of is political activism and activism in my union. And so I had sort of mapped out a life for myself of doing a lot more of both of those things. And so that's probably not going to be able to do that as things stand right now.
Everybody now! This plan is your plan, this plan is mine.
Much is in the news these days regarding health care reform, also known as the Affordable Care Act. But regardless of your political position, there are a few basics about the Affordable Care Act or health care reform that you need to know and how it affects you. First, the new health care law is designed to give you, the consumer, more control over your health care by offering new ways to shop, compare, and buy insurance in the new online healthcare marketplace. To learn more, visit www.healthcare.gov. Second, the marketplace will offer you 4 tiers in which to choose a health insurance plan. The tier you select will determine your cost-sharing ratio for medical expenses. For example, bronze plans, the insurance company share is 60%, your share is 40%. Silver plans, the insurance company's share is 70%, your share is 30%. Gold plans, insurance company's share is 80%, your share is 20%. Platinum plans, insurance company's share is 90%, your share is 10%. Third, depending upon your age, gender, tobacco usage, geographic location, and your ability to qualify for tax credits, and that determination is based upon your adjusted gross income and how much you actually end up paying for your premium and other out-of-pocket expenses, gets complicated. We'll save that topic for another blog. Finally, and perhaps most important, you need to have a plan if you can't afford the new bronze, silver, gold, or platinum plan premiums. That would be 4% to 9.5% of your adjusted gross income, or afford to pay deductibles 10% to 40% based on plan, copays, and other out-of-pocket expenses, or afford a separate monthly premium for dental and vision insurance. Adult dental and vision services are not essential health benefits under Obamacare, or qualify for tax credits and subsidies for surgery. To protect yourself and your loved ones from the devastating financial impact of an unexpected hospital stay or an emergency room visit, consider signing up for discount dental plans and health care plans here. Although a discount health or dental program is not insurance, a top-notch discount dental plan or a health plan program can significantly reduce your out-of-pocket expenses while providing you access to affordable, quality health service providers. Furthermore, to help families avoid financial ruin, some discount health plans and discount dental plans even include hospital advocacy services to assist with high medical bills. Hospital advocates take a team approach and work with all parties involved to find ways to negotiate a lower bill and establish payment plans when appropriate. So, if you're looking for an alternative to the Affordable Care Act, consider a reputable and well-established discount health plan or one of our quality discount dental plans. Ameriplan is one of the reputable discount programs available to individuals within the United States. Ameriplan's Platinum Freedom Pass, Total Platinum, and Healthcare Plan all provide you with that alternative. Dental Insurance Colorado, Ameriplan Discount Health, and Discount Dental Plans are designed to save money while providing the health and dental care you and your family needs. Get started now and you'll be amazed at the level of medical and dental services and the low cost.